Hello students, today in the third part of the topic emerging and re-emerging bacterial infections, we are going to discuss on two important diseases caused by the two important pathogens, Rickettsial and chlamydia. So in this session we are going to discuss on the Rickettsial infections, and in the second part we discuss on Psittacosis, a chlamydial infection. First we will discuss on Rickettsial infection. Rickettsial infections are caused by an unusual type of bacteria that can live only inside the cells of other organisms. They are intracellular parasites, obligate intracellular parasite. Most of these infections are spread through arthropod vectors like ticks, mites, fleas and lice. Some diseases also spread through other modes. Generally, a fever or a headache or sometimes or most probably a rash develop and people feel generally ill. The symptoms suggest the diagnosis, and to confirm it, doctors do special tests that use sample from blood or a sample from the rashes. What are the diseases caused by Rickettsial? Rickettsial causes different types of infections. These include Rocky Mountain spotted fever, epidemic typhus, ehrlichiosis, anaplasmosis and Q fever. I am not going to discuss all these infections in detail, but in this topic I am going to discuss only the general features of Rickettsial infections and their importance. Why the Rickettsial differ from other bacteria? Because they can live and multiply only inside the cells of another organism. I have already told they are obligate intracellular parasite. For their multiplication, they require a host cell. Many species of this bacteria live in small animals such as rats and mice, but some species are found in domesticated animals like cattle, sheep, etc. Humans are the unusual host. The human infections are rare and the humans are unusual host, and the human infections are spread from this type of animals to humans through the insect vectors. Q fever caused by Coxiella burnetii is a species, can be spread through other mode, that is the air or contaminated food and water. All other diseases are mainly spread through the infected arthropod vectors, through the tick bite or mite bite. Each species has its own host and usually its own vectors. Some of these bacteria occur worldwide, and the diseases also occur worldwide. Others occur only in certain geographic regions of the world. Some of these bacteria infect the cells lining small blood vessels, causing the blood vessels to become inflamed or blocked or to bleed into the surrounding tissues. Other bacteria, especially Ehrlichia and Anaplasma, enter white blood cells. Where damage occurs and how the body responds determine which symptoms develop. That in the case of Rickettsial infections, the major part is shown. Major role is of the immune system or the immune status of the patient or the person. How the immune response occurs, based on that symptoms will develop. What are the symptoms? We look what are the symptoms of Rickettsial infection. I am explaining only the general features of Rickettsial infections. Different Rickettsial infections tend to cause similar symptoms. The common symptoms are, after infection, fever, severe headache, a characteristic rash appear, a general feeling of illness, that is a malaise, that the body weakness is always seen with all types of Rickettsial infections. A sore covered by black scab or scar may form at the site of the bite. At the site of the insect bite or the vector bite, an scar is seen. As the infection progresses, people typically experience confusion and severe weakness, often with cough, difficulty in breathing and sometimes vomiting. When the infection is advanced, gangrene may develop, the liver or spleen may enlarge, the kidneys may malfunction, and blood pressure may fall dangerously low, causing shock. Death can result in some situations due to these complications. How can the disease be diagnosed? A doctor can easily identify by seeing the symptoms. And for the confirmation, blood test and biopsy from the rash is taken. Okay. Because transmitted by ticks, mites, fleas and lice, doctor asks people whether they have been bitten by a tick or another vector, whether they have traveled to an area where these infections are common. Being bitten is a helpful clue, particularly in geographic areas where rickettsial or related infection is common. Then if doctors suspect Q fever, they may ask whether people were at or near a farm, because the Q fever is mostly contracted from the domesticated animals like cattle, sheep and goats. Symptoms also help doctors diagnose these infections. Doctors also ask people how long it took for the rash to appear after they were bitten, whether they have other symptoms. A physical examination is done to determine which part of the body are affected and what the rash looks like. Doctor also look for a scar. Testing is usually needed to confirm the diagnosis. Often, doctors cannot confirm an infection with rickettsial or rickettsia-like bacteria quickly because this bacteria cannot be identified using commonly available laboratory tests. Special blood tests for these bacteria are not routinely available in normal laboratory setup and take so long to process that people usually need to be treated before test results are available. The patient needs immediate treatment if rickettsial infections are suspected. Doctors base their decision to treat on the person's symptoms and the likelihood of the possible exposure. Useful tests include blood tests that detect antibodies to rickettsia or rickettsia-like bacteria. If people have a rash, removal of a small sample affected skin for testing as a biopsy is done at the site of infection. Doctors use two techniques to make the bacteria easier to detect and identify: in immunofluorescence assay for antigens and the polymerase chain reaction. These are the two important methods for laboratory diagnosis of rickettsial infection: the PCR and the immunofluorescence assays for the rickettsial antigens. Then how we can treat the rickettsial infections? Antibiotics are usually started without waiting to get the result of the test. It is very difficult to diagnose the disease. Never wait for the confirmation of the disease. If the symptoms starts immediately and suspect it is a rickettsial infection, immediately the antibiotic therapy should be started. Early treatment of rickettsial infection can prevent complications from developing, reduce the risk of dying and shorten the recovery time. Rickettsial infections respond promptly to early treatment with the antibiotics doxycycline. This is a preferred antibiotic for rickettsial infection, or chloramphenicol. These antibiotics are given by mouth unless people are very sick. In such cases, antibiotics are given intravenously. If the patients or the patients are not in serious condition, the antibiotics are given orally, or in the case of unconscious or severe conditions, the antibiotics are given intravenously. Ciprofloxacin and other similar antibiotics may be useful to treat Mediterranean spotted fever, but are usually not used to treat other rickettsial or related infections. The next is psittacosis or parrot fever. What is psittacosis? It's a rare infection caused by Chlamydia psittaci, a specific type of bacteria. Chlamydia differs from, the chlamydia are having some differences between bacteria, it differs from bacteria. It's not a usual bacteria. That's why I included these two different organisms in a separate or in the third portion. It's a rare infection caused by Chlamydia psittacosis. It is a bacteria, but it is a different bacteria. It differs from normal bacteria. Also known as parrot disease or Psittacosis. According to the Center of Disease Control and Prevention (CDC), the United States has seen fewer than 10 human cases of parrot fever each year since 2010. It's a rare infection. However, many cases may be undiagnosed or unreported because the symptoms are similar to those of the other illness like flu. It resembles flu. As the name suggests, the disease is acquired from birds. Parrots are not the only possible culprits. However, other wild and pet birds may also carry the infection and pass it to humans. Where the disease is common. I told the disease is very rare. It's reported in different countries including Argentina, Australia, England. It may be found anywhere birds are kept as pets or in large continued populations such as poultry farms. It's more common in tropical environments. What are the common birds carriers? It's a bird disease or transmitted from birds to humans. In most cases, humans catch parrot fever from birds, including parrots, chickens, turkeys, pigeons, parakeets, cockatiels, and ducks. How does it spread from birds? Mainly, it spread by handling an infected bird or contact with infected bird, breathing in fine particles of its urine, feces, or other body excretions. Bird bite you or kisses. When bird bite you or when you kisses the beak of the birds, the transmission can happen. Catching the disease from an infected person is also possible, but it is a very rare. From human to human transmission is also there, but it is a rare event. This may occur when you inhale the fine droplet that are sprayed into the air when the sick person coughs. That is, it can be transmitted from one person to another or from patient to another person through the droplet nuclei or through droplets. What are its symptoms? It resembles flu or pneumonia. Symptoms usually begin approximately 10 days after exposure, but they may take as few as 4 days or as many as 19 days to show up. The normal incubation period is 10 days, but it may range. The symptoms include fever and chills, nausea and vomiting. Nausea means tendency to vomit, and sometimes vomiting will be there. Then muscle and joint pain will be there. Diarrhea, weakness, fatigue, cough, typically the dry cough. Other symptoms include chest pain, shortness of breath, sensitivity to light. In rare case, the disease may cause inflammation of various internal organs. This includes the brain, liver, and parts of the heart. It can also lead to decreased lung function and pneumonia. Is there any diagnostic method? Your doctor may not suspect this disease at first because it is rare, but sure to tell your doctor if you have recently been exposed to any potentially sick birds, or if you work in a pet shop or veterinarian office, poultry processing plant, or any other workplace that puts you in contact with birds. You have to tell your history. Your doctor will generally perform several tests. This includes blood and sputum culture that can reveal whether the sample contains this particular bacteria. A chest X-ray can show the pneumonia that is sometimes caused by the disease. Antibody titer test also used for the rapid diagnosis of psittacosis. Is there any treatment? Yes, antibiotics are there for the treating psittacosis. Mainly the tetracycline and doxycycline are used for the treating the psittacosis. Are very effective drugs against this disease. So very young children may be treated with azithromycin. In young children or in very young children, azithromycin is the antibiotic of choice. After diagnosis, antibiotic treatment typically continues for 10 to 14 days after the fever resolves. Next is an important thing, how we can prevent psittacosis. What are the tips to prevent psittacosis? Buy pet birds from a reputable pet shop. That's the important thing. Wash your hands regularly after handling birds or bird supplies. Avoid touching a bird's beak to your mouth or nose. Take birds that look sick to the veterinarian. Keep birds in a well ventilated area. If you acquire a new bird, have it looked at by a veterinarian. It's good to then isolate the bird and monitor it for sickness for at least 30 days before you allow it to contact other birds. Okay, you have to, if you buy a new bird, you have to first you have to check it with a veterinarian, and if it is good, you have to isolate it for 30 days and you have to check whether it is having any disease, and then only you can allow these birds to mingle with other birds. Thank you.